everybody. You guys all know me. I'm your Minna Van Dyken MD. I'm a surgeon by trade. My true passion is helping people just like you obtain optimum health by adopting whole food, plant-based lifestyle. So not really a diet, but lifestyle. I'm here today with a special guest. This is Dr. Shivam Joshi.
Hey everyone, glad to be here.
I am so glad you are here. This is awesome. He is a nephrologist, so a kidney doctor. Also a primary care doctor, I understand.
And a plant-based lifestyle medicine doctor.
Sweet, everything.
Yeah, a little bit of everything.
I love it.
Yeah, thanks for having me. This is so nice, and what a wonderful backdrop.
Yeah, I wish you guys were here. It's quiet, there's some birds chirping, you can smell like this amazing pine. It's just phenomenal.
Yeah.
It smells good.
And can I say my line now? Out of the doldrums and into the woods?
I love it! Out of the doldrums and into the woods. That's great.
Yeah.
Awesome.
Yeah.
So, not to embarrass you or make your public life or private life too public or anything, but congratulations
thank
on
you.
your recent
Yeah,
engagement.
yeah. It's
That's
it's
so
very
cool.
very exciting. Yeah.
Yeah.
If I'm coming all the way out here to Hawaii, why not make the most of it in one of the most scenic and romantic places in the world? So.
Totally.
Yeah. So.
Awesome. Well,
Yeah.
congrats.
Thank you.
So before we get started on the science-y stuff, maybe we can talk a little bit about you and your story. I
Yeah.
understand you were interested in kidney transplantation, and where did all this start for you, and what was your journey?
Yeah, so I started, it all started in medical school. When I got to medical school and I didn't know what I wanted to do or what I wanted to be. I knew I wanted to be a doctor, but I didn't know what type. And one of the things that appealed to me actually was kidney transplant surgery. It's so cool to take another kidney from someone else and recycle it, put it into another person, have it work, and you're taking an organ that otherwise would not have, would have been discarded or left to pass with someone's body, and then putting it to someone who could really benefit from it, someone who's on dialysis or kidney failure.
Absolutely. And sorry to interrupt, but I just want to interject. When I was on my transplant rotation, that I agree, it was one of the most fascinating surgeries you can do. You
Yeah.
basically take this thing that looks dead, like a piece of meat in an ice cooler, and you very carefully sew the blood vessels together, and you unclamp, and the blood flow just goes into this kidney, and it comes to life.
Yeah,
and all of a sudden, the
exactly.
ureter starts spurting out urine, and you're
Yeah.
like, what? It's
Yeah.
fantastic.
Yeah, and then a person's life is changed, and they're so excited, and you do a good thing for them and then for society because it's so much more cost effective to
Right.
have someone with a kidney transplant. They can go back to work, they can go back to school, they can become part of the family again.
Yep.
So it's really just a wonderful thing, and I was very interested in doing this, and I found a mentor. I was at the University of Miami, and my mentor, Gaetano Chancho, who's a transplant surgeon there. He was there at the time and still is there now, and he's still doing what he loves. And for several years, I thought I was going to be a transplant surgeon, and then at the end, I realized just how much time and effort and work it takes to be a surgeon. So hats off to you to sticking with it. I washed out. To be a surgeon is you have to commit a lot already, and then to be a transplant surgeon, you have to commit everything. And I just remember him saying that you really, everything else in life, family, friends, hobbies, kind of goes out the door because you're doing transplants, and you can be there for days on end. When the donors come, you have to go harvest them, transplant them. So that kind of deterred me because I wanted to be in the woods from time to time and do fun things. And so then I thought, oh, maybe I'll be a transplant nephrologist. So you can still work with the surgeons, still work with the patients, still do a lot of these things, work on these issues. And so that was the course I had charted out. So I did my internal medicine residency, and it was around this time that I started looking into plant-based diets. Someone gave me the China study, and I thought, I keep hearing about this book. There's probably nothing in here that I don't already know because I just graduated from medical school. What could there possibly be in this book that I don't know? And there was a lot, actually. Pretty much everything in the book was never mentioned in medical school, and that's so common for us physicians. And that book led me to read more books, and it influenced me personally. I became vegetarian and then vegan and then I like to say whole food plant-based, and then that also reflected into my practice too, because I felt it to be unethical or immoral to withhold this information from a diabetic or someone who's hypertensive or obese.
Yep.
You just feel strongly compelled to tell them. And fast forward, hundreds of papers, if not more, and here I am, spreading the word about plant-based diets, specifically in kidney disease, and that's really my goal now. I did my nephrology fellowship, and then but what I realized instead of being a transplant nephrologist is that you focus so much on the consequences and the aftermath of kidney failure, but what about preventing it? And we have preventative cardiologists, but we don't really have preventative nephrologists.
Absolutely.
So if I wear a lot of hats: nephrology, primary care, plant-based medicine, but one of the hats I think I would like to wear or hope to wear in the future is maybe preventative nephrology, if that's a thing.
I think you should start a new field.
I should start.
You should be the grandfather of the field of
Right.
preventative nephrology.
Right, exactly, yeah.
Yeah, it's so huge, and it's analogous to the sink that the faucet's on and it's overflowing.
Right,
and
exactly.
You're mopping up the floor, and I'm mopping up the floor in my job.
Right, exactly.
And it doesn't feel right.
Yeah.
And then back to the unethical not to be helping patients in that way. I totally agree. Like the Hippocratic Oath, first do no harm. And
Right,
I feel like
yeah.
we're doing harm by not educating our patients, or
Right.
somehow at least letting them know. And if they're educated and they say no thanks, then that's one thing. But if they
Right.
don't know, then that's a whole different thing.
Exactly.
Yeah.
And we also may be doing harm by just being passive bystanders and not saying anything or
Yeah.
not being involved. Some physicians say, oh, it's not my responsibility to tell someone what to eat. I'm not adequately trained, or I don't think it's my place. That's a place of a nutritionist or a dietitian. But then we in effect let this happen. We are accomplices to dietary indiscretion and poor lifestyle choices.
Absolutely.
And if we have that moment and opportunity, and as physicians we counsel people in so many other ways. We tell them to stop smoking, to get pap smears, to do colonoscopies, and all these other things. It's not unreasonable to tell them to, hey, eat an apple every once in a while, or more.
Absolutely. More than every once in a while.
Yeah. At the very least, yeah.
For sure.
Yeah.
That's so true.
Yeah.
So, talking about kidneys, you and I both know, and you way more than me, very intimately what the kidney does. What are they good for? Why do we care? Can
Yeah.
you briefly explain, what are the kidneys? Why do we care?
Yeah, most people don't care, and I understand why. The kidneys are they're very subtle. They do their job in the background. When they do it right, we don't really pay attention. Right. And they also don't have this wow factor like other organs of the body, like the lungs or the heart. If you stop breathing or you're choking, that's very, or the brain,
yeah.
Right, for strokes or heart attacks. So the kidneys don't. There aren't PSAs for dehydration or other kidney problems, and rightly so. The kidneys kind of fall on the back burner, but for people who do have kidney problems, it's very much on the front burner, or it being a priority. And what the kidneys do, and how I explain it to people, is that imagine if your kidneys didn't work, it would be you would not make any urine, so everything you drank would just accumulate in your body. And then day after day, you become more swollen, you become fatigued, and you slip into a coma. And that's how I explain it to people. And when you think of your urine, all the yellow stuff and all those waste products, those things just accumulate in your body as your kidneys decline in function. And then for people who have kidney disease, these issues become very important to deal with. And plant-based diets, which I thought had no relation to kidney disease, actually are very related to kidney disease, because number two cause of kidney disease are diabetes and hypertension respectively, and both of these are preventable and can be treated and controlled, and we think perhaps even kidney disease could be slowed or even reversed by controlling these underlying diseases.
That's fantastic.
3/4 of kidney disease, of kidney failure, is caused by diabetes and hypertension.
Right.
And then if you break down diabetes, so type 1 diabetics, you can't really prevent type 1 diabetes unless perhaps if our understanding is correct, and there's perhaps a partially modifiable role for lifestyle in preventing type 1 diabetes, and maybe in that way, but more what we think of as preventing type 2 diabetes, which we know is definitely affected by lifestyle. So most cases of diabetes are type 2, and most cases of hypertension are caused just by lifestyle and discretion. And it's about 80 and 90% of both. So when we start thinking about it, some of the cases caused by hypertension and diabetes for kidney failure, 80 and 90% of those are theoretically preventable. So by extension, 80 and 90% of kidney failure is theoretically preventable.
Right, and that's huge because in my limited experience of patients that have kidney failure, it seems like a lot of the mindset is, you know, there's nothing I can do about it. It wasn't preventable. There was nothing. And especially once you already have it, I think the attitude is there's not much I can do lifestyle-wise to make it better.
Right. Yeah, and I tell people it's never too late. Even if you have kidney disease, it still may not be too late. And not everyone has return of kidney function or improvements in kidney function, but at least you can modify some big things like complications of kidney disease, like metabolic acidosis, phosphate levels, blood pressure, and mortality. So plant-based diets are really good because they help reduce mortality, which is obviously good because no one wants to die, but what patients don't realize is they have a higher chance of dying than progressing to dialysis. Everyone's afraid of going on dialysis, and rightly so, because dialysis is this terrible endeavor, this terrible treatment. You're hooked up to a machine 4 times a week, usually through a surgically made fistula, and it's poking out of you, and you have these needles going into you, sit in this chair for 4 hours, and people hate dialysis, and I get it. You have to give up your entire life to stay alive, which doesn't make sense. But what people don't realize is that kidney disease, and maybe because the causes of kidney disease are so bad for health, is that it actually increases your risk of dying, and not perhaps 1 or 2-fold in some of these observational studies. It's between 60 and 40 times higher than progressing to dialysis, which is an astronomically high number. So if plant-based diet, if anything, can perhaps reduce your mortality with kidney disease, and there's this association with plant-based diets, then why not pursue it?
Absolutely.
Yeah.
Yeah, and kind of bouncing off of what you said, where I see patients with diabetes is when it's pretty late in the game. You know, they have either ulcers or wounds from diabetes, or unfortunately need amputations, or that type of thing. And the one thing that we learned in training as surgeons is those patients, you watch out for heart attacks. They are like set up because they have disease in their blood vessels in their legs. They probably have it in their coronary arteries or their heart too. So it's all related. It's not like totally separate.
Right, and then in their kidney too. So it's all related. So the one thing I like about plant-based diets is that it's one diet for so many diseases. If you have diabetes, you're overweight, you have kidney disease, heart disease, it's one diet and it treats all these processes.
Yeah.
Yeah.
Yeah. Cool. I just met you yesterday, but I think you are awesome, and you're kind of a very playful person. So can we play a game?
we can play
it's
a
called
game.
Mythbusters. Bust the kidney disease myth.
Okay, I did. Yeah, I guess there are myths out there. Yeah, let's get to them.
Myth. Okay. And these are things that I see, and I think they're probably just common in patients that have kidney disease. So myth number 1, I have kidney disease. I really, really have to watch my potassium levels, so I can't be plant-based because I can't eat fruits or vegetables.
Yeah. So partially true, partially false. Because it depends on your kidney disease. If you have advanced kidney disease or on dialysis, stage 4, stage 5, you definitely need to watch your potassium levels no matter what you're doing. Even medication changes, even small changes in kidney function, changes in diet can affect potassium levels. But to say that you can't do plant-based diets is not totally correct either. And people with advanced stage kidney disease, stage 4, stage 5, even patients on dialysis can do plant-based diets. And it's been shown in the literature, there's several studies, many studies now, showing that people can do it safely and to their benefit. And potassium levels don't necessarily go up. And actually there's only one instance that I know of where a potassium level went up, and that person had a pre-existing condition in the literature. But there are ways you can do plant-based diets wrong, and that can raise your potassium level. So potassium is found in a lot of plant foods, so like fruits and vegetables. And if you extract the potassium and essentially get juice, the juice is you can think of it as a potassium extract, and drink that, then that will raise your potassium level. And I've seen it myself. I've had patients who drink juice and they say, why is my potassium up? And it's because of that. Because think of an orange, a cup of orange, a glass of orange juice, 8 ounces of orange juice. There's probably 4 oranges worth of juice in there.
Right.
No one really eats 4 oranges at a time, but within a span of 5 minutes, you can gulp down a whole 8-ounce glass of orange juice and get the potassium of 8 oranges.
Yep.
And on top of that, you're not getting the fiber in those oranges.
Yeah.
Fiber is so good for so many reasons, including treating diabetes and weight, but also for lowering potassium, because fiber helps you have bowel movements. Not to talk about poop, but
I like to talk about poop.
But sometimes you have to talk about poop.
Yeah, yeah, for sure.
Yeah.
So like we've talked about in other videos, guys, the fiber is huge, and our nation, the world as a whole, is pretty much fiber deficient. So we got to try to get more fiber. It's never bad. Juicing cuts out that fiber, like you said. So it can definitely cause spikes in blood sugar as well. And like you were saying, with potassium and all the nutrients that you would get, you can definitely get big doses.
Yeah. So keep the fiber in there. So juices are something to watch out for, and so are sauces. Which are basically like a thickened juice. So like your tomato sauce or can be big culprits. Your marinara sauce. So those are things to watch out for. So if you take, and actually when you look at the literature, most instances of elevated potassium in patients that have occurred who and they necessarily haven't been on a plant-based diet were from instances of juice or sauces. And in some cases, eating a lot of dried fruit. So eating too much dried fruit, exclusively dried fruit, it can also be problematic. But most people generally do just fine eating, a serving or 2 of dried fruit a day, as long as you're not doing too much.
Sure. So second myth: I am vegan, therefore I cannot get kidney stones.
So that's a hard guarantee to endorse.
Good.
So what I will say is that you can be vegan and eat unhealthy.
Yep.
And you probably could eat so unhealthy that you could get a kidney stone. But what I more commonly hear is that patients tell me that, oh, my doctor or someone told me that I can't eat all of these plant foods because they have oxalate, and that'll increase my risk of having a kidney stone. And that is definitely a myth that we should debunk.
Let's do it.
Yeah, debunk out there. Yeah, we'll clear up this confusion. Hopefully, no one will be confused after this.
Yeah. So high oxalate foods, like I know, you can get a list online or whatever that talks about the high oxalate foods, and spinach is generally at the top.
Yeah.
What are some other ones, or?
Cashews, Swiss chard, beet greens, star fruit, which no one really eats star fruit, but these are
in Hawaii we do.
Oh really?
Oh yeah.
Oh yeah. Well, star fruit is like astronomically high in oxalate level. So it's okay to eat these in normal servings. So if you're having a sandwich and there's a little bit of spinach on there, or if you're having a fruit bowl and there's a little bit of star fruit, that's fine. Where people start getting into trouble is when they start eating a lot of a food that has a lot of oxalate. So for a common example, and one that's been cited in the literature, is that people make smoothies out of spinach, and as you know, spinach is mostly water, and if you cook it, it shrivels down. And in order to get a little bit of bulk, people add a lot of spinach, or they do several smoothies a day. And then that increases perhaps your risk, because you're just taking in so much oxalate that inevitably some of it's going to get absorbed, and it's going to increase the amount of oxalate in your urine. The other issue is that if you have a predisposing condition to really absorb oxalate, so these are your people who are having intestinal problems, they have inflammatory bowel disease, they've had bowel surgery, they are on vitamin C supplementation, or they have something else. Antibiotics are another big one. Antibiotics wipe out your gut flora and then really allow you to absorb oxalate.
Interesting.
So these are the people, and sometimes there's people who have multiple things going on. They're doing the green smoothies, they have inflammatory bowel disease, they happen to be on antibiotics and doing all these things, and then boom, they have a stone. All these things contribute to the stone, but then it gets passed along to the average. They tell their friends, like, oh, don't do these spinach smoothies because you'll have oxalates too, or you have an oxalate stone, or don't eat spinach at all. And that may not necessarily be true. So if you it's probably okay to add a little bit of spinach to a smoothie, to eat spinach in everyday life, but just don't go crazy on these things to be safe. And the other thing is that what actually increases oxalate levels in the urine is actually animal protein. So reducing the amount of oxalate you take in within for the average person doesn't really affect the oxalate levels in your urine for the average person. But animal protein does increase oxalate levels in your urine for the average person. But the long story short is that people eating plant-based diets, your vegetarians, actually have a lower risk of kidney stones, and that's been shown time and time again in different places for different people over and over through the literature. When people say that vegetarians are at increased risk for having stones, that's incorrect. And something in our diet is inherently protective. It may be the water content, it may be the natural alkali in these foods, it may be the lack of just animal protein, which we know is a risk factor for kidney stones. There's a lot of things that go into it that I think are protective.
Right.
But there are examples, like I mentioned, of people who are plant-based having a kidney stone, and I think it's because they either overdid it or they had one of those predisposing conditions that I talked about.
Sure. That makes perfect sense.
Yeah.
So you touched really briefly on hydration. So dehydration is a huge risk factor to getting a stone, right?
Right.
That's a big one.
Yeah.
Okay.
Yeah. So it's like that saying, the solution to pollution is dilution. It's the same way with kidney stones. So to prevent kidney stones, you have these ingredients, and if you want to dilute them out, so drinking more water is beneficial. So when I see patients who have kidney stones, I tell them the big three things are to drink more water, eat less salt, because salt increases the amount of calcium in your urine, and that calcium is one of the ingredients you need to form a calcium stone.
Right.
And then to eat less animal protein. Animal protein has been linked to kidney stones for going back to World War II. So those big three things, if you do those, can reduce your risk of having a kidney stone in the future.
Cool.
Yeah.
For my own curiosity's sake, I don't know if you have an answer to this, but how long do you think it takes to form a calcium oxalate stone? Can it happen like overnight, or is it something that you build for years, or?
That's a good question.
And I know it's totally off the wall.
I don't know if it can happen overnight, but probably weeks to months if I had to guess, because we've done imaging on people, and people who didn't have stones, we see stones later, but did those stones just disappear from view and then they reappear?
Right.
Or they were too small to be seen. So I don't have an exact number, but it's certainly not as fast as overnight, because these things have to precipitate and has to accumulate. So I would say probably weeks to months in a fast one, but they can grow very slowly, and they can also dissolve very slowly too.
Right.
Yeah.
For sure. I had one more thing I wanted to ask you about that.
Have I ever had one? The answer is yes.
Have you ever had one? You've had a kidney stone.
Yeah, it's very painful.
That was before you were plant-based?
Before I was plant-based.
Yeah.
Because I was doing everything wrong. I was not drinking water, I was eating too much salt, and I was eating a lot of animal protein.
Huh.
Yeah.
So you know.
Yeah, we lived it.
Horrible pain. Wow.
Yeah. Yeah.
So back to your practice, how do you feel your patients respond to you, and how do you approach them with dietary information and education?
Yeah, so I wear multiple hats, and I try and talk to all of my patients who have a lifestyle-related issue about their lifestyle, because I feel it is the smoking of our generation.
Yes.
And if we don't say anything, we're letting someone, in effect, continue to smoke, or in this case, continue to eat unhealthy or not exercise, or just be overall unhealthy. And I try and tell people, even if they're walking out of the clinic room, to exercise a little bit more, trying to eat more plant-based, eat more fruits and veggies. I have a little handout that I give them. It's called our Superfoods handout. And I also am part of this plant-based lifestyle medicine clinic, which on Wednesday afternoons, I work with Dr. Michelle McMacken, who's the founder and an organizer and creator and my mentor and all of these things. I work with her in the clinic, and then 2 other physicians, Dr. Sapna Shah and Dr. Rebecca Boaz, and we have a wonderful plant-based lifestyle medicine health coach, and she works with people on going out into the woods like this and relaxing and getting enough sleep and exercising, so addressing all of these core aspects of health. And we have a wonderful dietitian who really gets into the nitty-gritty and talks to people about how to eat, how to learn to eat all over again, how to learn how to cook all over again, which are both very important, because it's one thing to tell someone to eat plant-based, but how do you do that, and what foods do you eat, and how do you make them? And you're overcoming a lifetime of bad habits and all these societal influences, and then to throw that out the window and start over, it's a huge challenge.
It is. And especially when you have multiple members in your household, and trying to navigate that change can be really tough.
Yeah, absolutely. And we see this all the time. Someone has something that clued them in. It was diabetes or weight or high blood pressure, or they heard something and they want to go plant-based, but the rest of the family doesn't. And what we tell them is bring your family in with you so they can understand how tangible this is for you. You could theoretically be on less insulin if you ate plant-based, but maybe they don't understand. They don't understand what's happening to your health and your body. And I invite the family to come in, and sometimes engaging all the team members or all the family members in the process is really beneficial, because then they start supporting the patient.
That's huge.
Yeah.
Yeah, I think behavior change, once you have a patient that's motivated and you have the structure of the clinic and everything, that's wonderful.
Yeah.
We're still working on building that out in Kaiser, Hawaii, for sure.
Yeah.
Yeah, it's a slow process.
Yeah, it's been a slow process for us, and it took a lot of work, mostly on Dr. McMacken's part, and but it's time and effort well spent, and the dividends are paying off for patients. We have a lot of people who are coming off medications, losing weight, walking more than they ever did, living their life to their fullest. It's really great.
That's so rewarding.
Yeah.
Gosh.
Yeah.
Congratulations.
Yeah, thanks. So we hope other places, other clinics, other physicians can do this. And if we can do this at Bellevue with patients who don't have a lot of resources in the middle of a city, we hope other people can recreate this and do this in some fashion or another.
Absolutely.
Yeah.
Now that you are the national keto expert.
Hardly. Standing on shoulders of giants, yeah.
Yeah, so let's talk about keto, because you just published a paper, an editorial, talking about the dangers and the unknowns about the keto diet. Tell us more. Right,
yeah, so this actually goes back to the paleo diet. So at the time I got into plant-based diets, paleo diets were the rage, and I had this competing interest, or this I don't know how to describe it, but I was just so concerned by the paleo diet because it didn't make sense with what I was learning in the plant-based world, that I was starting to accumulate all this literature on the paleo diet, and perhaps where they erred in their ways or things that didn't add up, and I never really shared it with anyone. It's all squirreled away on an old hard drive in my parents' home, and I never really shared it with anyone, and it was to no benefit really for anyone out there. But fortunately, the paleo diet has come and gone, but in its wake, another low-carb diet has emerged, and that is the keto diet. And initially, I did not think that the keto diet would become all the rage, but I started looking into it anyways, and pretty much all I know about it comes from my mentor, Dr. Michelle McMacken, who was a senior author on her paper. And through this process, I've learned a lot, and there's a lot of overlap with many other low-carb diets. But the keto diet is different from other low-carb diets in that it is the lowest carb diet. You're essentially cutting out all carbs to eat pretty much just fat, and you're getting a little bit of protein to meet your needs. But in some cases, you may qualify for as meeting a high-protein diet, at least in the renal literature. But the main emphasis is on eating a lot of fat and avoiding carbs. And the idea is that if you cut out carbs, you can increase your metabolism, you can burn fat, you can lose weight, and you can look good, and you can be a model for a postcard in Hawaii. But there's a huge caveat to this, is that much of the research really hasn't panned out in favor of the ketogenic diet. What the research has shown is that the diet is beneficial in cutting out calories and restricting calories like any other diet.
Sure.
And if you do that, you can lose weight. So in effect, the benefit of the diet is that it gives people a rule book or a handbook on how to cut out calories. And you could do this any number of ways. Any other diet, you could do a cookie diet, you could do any number of other diets to limit your calories, and you'll lose weight. So, and I think that's what people overlook, and that's one of our main points in our editorial that came out last month, is that this keto diet isn't unique like that. It doesn't drastically increase your metabolism to burn an extra 200 or 300, 500 calories per day like some people quote. And the other reason people use a diet is for diabetes, but when you look at these long-term randomized controlled trials, the effect tends to wear off. So there may be an initial benefit in the short term, but over the long term, there's no benefit at 12 months. And so what I tell people is, why would you take on a diet that doesn't really have much benefit for diabetes, and also for weight? When you compare the diet to other diets, there's no difference between diets that restrict calories in the same way, in a way that to help you lose weight. So in effect, the diet is no better than really any other diet, and it perhaps may have side effects, which most notably increasing LDL cholesterol. We don't know if down the road if there's going to be disastrous complications with the microbiome or cancer or heart disease, because there is that increased that signal of increased LDL, bad cholesterol, and apolipoprotein B. So these could potentially cause problems for heart attacks, strokes, things like that. So to recap, and we basically say this in a much longer, more eloquent way in our editorial, but to recap, why I wouldn't recommend someone to do the ketogenic diet, be it if they're a patient, friend, family member, I would tell them the diet doesn't really have any benefit over any other diet for weight loss or diabetes, and it may have side effects like raising cholesterol, and in some cases kidney stones and a bunch of other things that we saw from pediatric epilepsy literature. And there's all these other alternatives, and there's no long-term safety data. So why would we jump on this? If this was a drug by a company or a pharmaceutical company, we would turn it down and say no, and say come back to us when you've showed us that it's safe, it's effective, and it works.
Absolutely.
But for this diet, I think there's these stories of people losing a tremendous amount of weight in the short term, and then these stories get replicated. And because it's so new and it's a different low-carb diet, and it potentially has a new mechanism that people are very interested, but I think we have to be grounded in how we apply this and how we generalize these assumptions.
Definitely. And even though we don't have the long-term safety data, or that, randomized controlled trial long-term hasn't been done, I don't know if they'll ever be able to do that. But we do know, just from inferring from other studies, we know that low-fiber diet, which is what a keto diet is very bad for long-term health. Increased colon cancer rates, diverticulitis, we got the heart disease connection, the microbiome that you talked about.
Right.
And the whole cholesterol linkage as well. I think we can infer that there are some concerns, definitely.
Right. Some keto advocates say that they eat a lot of fiber, and theoretically it's possible.
Yes.
I think some of the people who are doing this thing called plant keto are getting the fiber, but I think the keto diet as advertised, that as widely adopted in the general public, I think, as you mentioned, is definitely low in fiber and is not a high fiber diet, and that's another great reason to bring up, and another reason to not emphasize eating fat. And instead, we should be eating these fiber-rich foods, your whole grains, your beans, fruits, vegetables, things like that.
Yeah, for sure. And that is one thing, you're right, that we didn't really talk about, was the vegan keto or the plant-based keto.
Yeah.
It's an interesting experiment as well.
Yeah.
I think you and I both know Danielle Bellardo, and
Right.
she tweeted all about her, what was it 2 weeks she did?
2-week trial, yeah.
Of plant-based keto, and she was saying, what was she getting, like 90 grams of fiber a day, some
Right.
insane amount. So she was getting her fiber. You're absolutely
Right.
correct.
But I think the only person who really could get that much fiber and do it right is her. And you know, she's you know, the paragon of perfection we all aspire to be. And I don't know if the average person who you know, clicks online and reads about the keto diet is getting 90 grams of fiber.
Right.
So I'm glad there's a way to do that, and plant keto could do that. But I don't know if the keto diet in general, as advertised, will get you there.
Agreed. And I think the second that you turn your focus from, you know, fiber or foods, and you change that to low carb, all of a sudden, automatically, you're cutting out a lot of fiber. Especially if it's animal-based keto, you're getting no fiber.
Right, and then people take it another step further and say, oh, apples are bad for you. And now all carbs are bad, and that's not true. It's your refined carbs, your sugars, your high fructose corn syrup, your processed foods that are bad. But you can't throw the baby out with the bathwater. Your whole foods, your fruits, vegetables, those things are still going to be great.
That's so true.
Yeah.
So we were in Costco today just buying a few things, and we bought a bag of cauliflower rice. And I like cauliflower rice. So we get to the counter, and the checkout guy was keto, totally keto. So Russell and I kind of look at each other, another, you know, and he starts talking, how do you like the cauliflower rice? And we're like, oh, we love it. It's good. You know, it's good with curries or whatever. And he's like, I don't buy this type anymore because, as you can see, there's 4 grams of carbs in there. And this and that, and he goes off. And I buy another brand of cauliflower rice, which both are essentially just mashed up cauliflower.
Yeah, right.
That has less grams of carbs, and he starts going off about carbs. And he said, so I just eat like cheese, you know, there's 0 carbs in cheese. And I'm thinking in my head, there's 0 fiber too. But it was one of those things where your jaw just drops, you know.
Plenty of saturated fat too.
Absolutely.
Yeah. Those moments you have to refer these people
I was like,
to the editorial.
This guy's in a hurry and he gets bonuses for how fast he checks people out. I'm not going to correct him. Thanks for the cauliflower rice. Have a nice day.
Yeah, we're not having this intellectual battle in like lane 8 at Costco.
It's quite the experience though.
Yeah, but that's the thing. People start demonizing these healthy carbs.
Right.
And these foods have been repeatedly shown to be beneficial over different times, different places for people, and it's just unfortunate.
Agreed.
Yeah.
Agreed.
Yeah.
Well, Shivam, this was a pleasure. It was so much fun having you here and shooting the breeze about stuff, keto, low carb. Kidneys,
plants,
nephrons.
Yeah, all things above. Yeah,
Totally.
The pleasure was mine. I really enjoyed this, and the setup is amazing. Yeah.
This is a phenomenal place.
Yeah.
If you guys ever come to Maui, check it out. Makawao National Forest. It's beautiful.
Yeah, we'll leave the trees behind.
Yeah. We won't leave a trace. But anyway, thank you again, and I appreciate you taking the time to chat.
Yeah, no, my pleasure. Thank you.
So that's it, guys. I hope you liked this interview. If you liked it, give it a thumbs up, please. If you want to show us some real support, subscribe. We love hearing from you, so if you have anything you guys want to know more about, if you want to dive deep into something, just let me know. We'll do a video on it. But until next time, aloha. Thanks for watching, guys. Oh, this is video? Okay.
Okay, 1, 2, 3.
How fun is that?
Screenshot it.
Oh, nice.